What are some tips or strategies for coping with the ongoing fear of relapse?
The question is, what are the tips for coping with an ongoing risk of relapse? That it's like a sort of Damocles hanging on your head, and I think we all are very cognizant of that, the emotional impact of that. At the end of the day, I still think it's the empowerment of the patient that would really help the patient to cope with this emotional strain. Again, this is something that we can possibly help, but it's not. We cannot. It's at the end of the day, it's the patient who is actually experiencing that stress, right? So the empowering the patient to cope with that is going to be the biggest benefit that we can potentially deliver. And I think the most important empowering element is the knowledge. That if you know that what's your risk of relapse, right? And if you have a very favorable disease, then your risk of relapse is way low. So of course, the stress is much less, right? And many of them can be quantified to an extent, because with the cumulative knowledge, it can be quantified to an extent. Say, in some patients with acute promyelocytic leukemia, if they're in remission, now the chance of relapse is extremely low, right? It's less than 10%, less than 5%, right? So, or on the other hand, the other group of so-called good risk acute myelogenous leukemia, core binding factor acute myelogenous leukemia, now the relapse rates are more in the range of, say, 30% or 40% as a ballpark number. Whereas if you're on the other extreme, in the adverse risk, your chance of disease coming back is possibly close to 50 to 70%, right? But having that knowledge is important, instead of kind of trying to figure out, trying to come up with a number to the chance of relapse, right? So that way, if you know that information. And the other thing is that how well you responded to the treatment. What's your situation about the minimal residual disease? When they look at the disease in a deeper way, either by looking at the mutations, by PCR technique, by flow cytometry, if there's very little detectable disease, then of course your chances of relapse are much lower. And this is not one point. It's not like a snapshot. That over time, over a period of 2 or 3 years, the longer you're in a very, very deep remission, the lesser the chances of your disease coming back, right? And so that information, having that information is important. And so the patient also would need to ask that question to the treating physician, that I'm in remission, but how deep is my remission? What's the quality of my remission? So, and that discussion always, I think, would help the patient. The flip side of it is that if you have a higher risk of relapse, if you know that you have a higher risk of relapse, then the next question is going to be that, how do I mitigate this risk? Should I get to a stem cell transplant? How early should I go for a stem cell transplant, right? Or there are other maintenance strategies that can be there. Not everybody is a stem cell candidate, right? You may be older, you may have comorbidities, you may not have a donor for that matter, right? But if there is a maintenance program that is showing some promise, maybe I should get on that to mitigate my risk. So what I'm trying to say is that information, having that information, I think, would be the most critical piece to cope. And of course, there are support groups that are available. Nowadays, a lot of these are web-based. They can be accessed, and family plays. I think the family plays a big role, and it's not a one-person fight. It's a fight with a team. Family is your team. Your treating physician is your team. Your nurse is your team. Your nurse practitioner is your team. So, again, seeking help from the team when you need it truly helps, I believe.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.